what's going on in regions 7 and 8. Today, region 7, that area to the south of Central Ohio, has the most COVID patients in the hospital on any day since the pandemic started in the spring of 2020. And region 8 is not far behind. A really significant increase, those same trajectory of that blue line over the last 6 weeks is really impacting that southeastern part of the state similarly. In fact, this led earlier this week to the hospital CEOs from 9 hospitals and health systems across the southern and southeastern part of the state to put out really what I've never quite seen before from this area of the state, a joint letter signed by all 9 CEOs. This is very similar to what the 4 Central Ohio hospital CEOs did a couple of weeks ago, and many of you have seen full-page ads, there's radio PSAs, but these 9 hospital CEOs are reaching out to their communities jointly in an effort to really talk about the impact this is having on their hospitals, on their ability to care for patients that don't have COVID in their communities. The good news is these CEOs were shared on a meeting we had yesterday that they're getting hundreds of thousands of shares and hits and views on their social media pages by members of their community that really want to share good information about what's going on in their community and the impact this is having in their towns or in their county with their friends. So it's hopefully a way that we can get the right message out through our social media channels, really from trusted local sources, which is your local hospital, your local provider. Last, before we go to our guests, I just wanted to give a quick highlight on where we are with COVID vaccinations. We continue to see higher rates of COVID vaccination over the last 4 to 6 weeks compared to where we were over the summer. And a really good piece of news, we now are really approaching basically at 85% of those over age 65 having at least their first dose of vaccine. And we just crossed 64% of all adults over age 18 having gotten their first dose of vaccine in Ohio. So really, getting vaccinated, a key part of any one individual's effort to fight COVID-19, but certainly a part of our community and our state's effort to fight COVID-19. So thank you to those who have gotten vaccinated, and thank you to those in the media who are continuing to share the accurate information about the importance of vaccination. So to our guests, I'll turn to Dr. Mohler first. Peter, any updates on where we are with the Delta variant, what we're seeing with trends in variants over the past week or two?
Great question, Andy. So at the Wexner Medical Center, we continue to actively sequence positive cases to really understand what the viral signature is. We've seen over the course of really the last few months, sort of an evolution from an alpha strain to Delta strains that we see as the dominant variants these days. We're also hearing, and you've probably seen in the news, Andy, some updates on something called the Mu variant. This is a variant that's coming out of Colombia in South America. While we are actively watching for some of these viral variants here in the Central Ohio area, we've not seen this. Delta continues to be the dominant variant, and very likely it's much more of an evolutionarily fit virus. And so we'll likely continue to see the Delta even out competing the Mu variant.
Great, thank you. Peter, you've been a scientist now for most of your adult life. You're used to reading scientific papers and trying to figure out if something that's being made as a claim in a scientific paper is valid, is verifiable. But put yourself a little bit in the shoes of Bob and Betty Buckeye that are seeing things come across their Facebook or Twitter feed. They're maybe reading something, hearing something at church or at work from a friend. How can the average layperson in Ohio work to judge what's good science versus maybe misinformation?
Yeah, great question. And we continue to see a lot of interest in science since the pandemic began. I would say 3 big areas that the public should look at. The first is how well the study was designed. So is the study controlled in a population that's large enough to be able to make an impact? The second thing, Andy, that we look at is whether something is peer reviewed. So if a claim is made, have other scientists actually had a chance to look at the data, or physicians to look at the data to say, this makes sense, or this is worth studying? And then the third thing we look at is something reproducible, meaning that if I take that same virus or those same tools and try to test this in 2 or 3 other labs, are my colleagues seeing the same thing as another? So I liken it to, I can go out as I'm a football fan, I can go out and buy a football, I can buy a whistle, and I can buy a t-shirt that says coach. That doesn't make me a football coach. And so what the lay public should really do is to look to see, are the experiments being performed by scientists that have a background in this area? If they click on a link, does it link them to 3 other links that aren't scientific papers, or does it link them to a TV show or a blog or a Facebook page? So those are the sort of red flags that we look at, and then continue to see that. A good example is what's happening in ivermectin. Ivermectin is something that's appeared on the news multiple times as a potential therapy for, or even a preventive therapy for COVID. We've actually seen some of the same rigor show that a lot of these studies that ivermectin has been claimed to reduce COVID infection or even therapeutic for COVID infection be now retracted. And so, some of these things are science being wrong, but a lot of these things are potentially dangerous in the doses that some of the original studies have come out with.
Well, I think your point's a good one about the link to the link to the link. I think when you're seeing someone's Facebook post or Twitter post, and that takes you to a blog, that takes you to an opinion piece, that takes you to another blog, and it never really gets down to where was that actual science done? And has that science only been done at one place by someone who's frankly not in the field? Or has that science been done and then done again and shown? There's always a first time something's reported, but it should be relatively reproducible relatively quickly. I think that's great feedback for folks. Thank you, Peter. Appreciate you being here with us this morning. Dr. Fredberg, I want to turn a little bit to our COVID recovery program. First, can you just kind of step back at the 5,000 foot level and talk about where we are with patients who've recovered from the acute phase of their virus, and what we mean by long haul as a type of symptom?
Yeah, sure. So, there are a lot of names here, and I know it could be confusing. And part of that is just, there are so many ways it can be. The official term from the National Institutes of Health, or the NIH, is post-acute sequelae of COVID-19, but lots of other terms: post-COVID conditions, long COVID, long haul COVID, post-acute COVID, long-term effects of COVID, chronic COVID. With all of that, I think really it comes down to this thing we've all kind of been seeing, which is, at least if you ask the CDC, what do they see most commonly? Fatigue, shortness of breath, cough, joint pain and chest pain, but it can be all sorts of different things. Problems with thinking and cognition, difficulty concentrating or even speaking, depression and anxiety and post-traumatic stress, muscle and joint pain, headaches, loss or change in your taste or smell, hair loss, rapid heartbeat, even fevers on and off. And the severity ranges too. It can range from sort of frustrating and temporary to really devastating and long lasting, and can really affect pretty much all aspects of life and function.
Thank you for that. Can you talk a little bit about our approach here in terms of how we've developed an evidence-based practice guideline in concert with our colleagues from Bon Secours Mercy Health that really tried to help providers and to some degree even help patients figure out their way through these sorts of symptoms?
Yeah, and again, it's a tough one because you can come in with lots of symptoms at once, or just one or several things. One of the privileges of being in an academic medical center and working with our colleagues is that we get to get this team of professionals together and look at the data, look through what information is there and what do we know, and try to put together a plan so that we and our colleagues know where to start and what things there's evidence for and what things maybe got tried and didn't work, what things may be harmful.
And I think especially making sure that we're not overdoing imaging tests and other really expensive tests that most likely aren't going to have any benefit for the patient in terms of an underlying cause of their symptoms.
Yeah, definitely. One of our biases is we always want to know, and so it's sometimes very tempting to order the test or the image because you want to see something. And one of the, I think, really frustrating things with COVID and post-COVID is that sometimes we do see things. For example, we can see things like fibrosis or injury and inflammation in the heart muscle for folks after they've had an infection with COVID-19, or we'll see scarring in the lungs. But what we've found is that there often is not a whole lot to see, at least with the tests that we have available. And so that doesn't make the symptoms any less real. It just means that we may not quite have the test yet to see exactly what's going on.
Got it. Can you talk a little bit about our clinic here? I know it got off the ground a few months ago, and you've really been refining how patients move through the system and how we take referrals.
Yeah, absolutely. So for our clinic, and the motivation here is that for me, I work as an internal medicine physician in primary care and also in the hospital. And for me, I was just seeing a lot of my own patients who had these symptoms and they just didn't know what to do. They felt really lost, and I just wanted to find a way to help them. I think folks can really feel very alone and scared and very misunderstood. Part of the challenge is these post-COVID complications that can leave folks often with really no outward sign of what's going on. And so I think this is true for a lot of chronic illness, but it can be really hard for other people to understand, why they're feeling that way and what they're experiencing with their illness. So, because it impacts so many different parts of the body, lungs, heart, joints, brain, we knew we wanted to work as a team to try to, give the best care for these folks who had post-COVID complications. And, the idea with our clinic is we wanted to have a space where, folks who are suffering, from this, it can get really close attention. It can benefit from our specialty knowledge. And basically we wanted to leverage the power of our academic medical center at Ohio State University to try to work to improve the quality of, folks with their daily lives when they're suffering from this.
Well, thinking about, once again, the average patient who hasn't had COVID and they're concerned about these kind of prolonged recovery type symptoms, what's the best way to prevent that?
So I wish we had a great way to, keep you from having this. I think it's, it's a pretty scary thing that, not only can you have this, potentially very terrible illness with COVID-19, but then it can stick with you for, who knows how long, months, years, we don't know yet. And the best thing that you can do is not get COVID in the first place. And the best defense we have is vaccination, is to go get vaccinated. There's no better way to do it. And there was even a study that came out, I think it was in the Lancet Infectious Diseases. It was a big study on the British population. And not only did we have a major reduction, 70+% in, getting infected if you've been vaccinated with, any of the several vaccines they had. But even if you caught COVID, when you've been vaccinated, your odds of having, long-lasting, COVID symptoms were cut down by almost 50%. So not only can you avoid it in the first place, then even if you get it, you're less likely to have long-term symptoms, which is pretty impressive.
That's just another good reason to go out and get vaccinated. Thank you for sharing that. At this point, we'd like to open it up to our colleagues from the media that are on. If you have a question, please either raise your hand in the on the Zoom link or type a note in the chat if you have a question. Well, one other question, I guess, Aaron, that I would have for you is what are we doing in terms of research? You mentioned the importance of being an academic medical center, of how we're approaching this. What are we doing in terms of research around COVID long kind of prolonged symptoms?
Yeah, I mean, it's an interesting topic because even though we don't have a test that tells you have post-COVID or even a single clear definition yet, I think we all know from our experience, taking care of these folks, that there's really kind of a common set of symptoms that goes along with this, with some differences between each person. But there's so much we don't know. What makes you more likely to have post-COVID complications? Some people feel terrible and some people feel fine. Why is that? And why do some people get better really fast? We'll see folks that lose their smell, but it's back within a couple of weeks. And other folks still can't smell, 6, 12 months later. What's different and what made that happen? And then what tests are useful? Like I was saying, what can we do to figure this out? What treatments are going to be most effective? So that's the nice thing about being in an academic medical center is we have this team of professionals where, we don't just provide care and apply what we know and what we're learning, but also we specialize in research and, try to answer those big questions to figure out the best way to care for our patients. And our, one of our goals is to, assemble information from our experiences taking care of folks and being there with them, and to not only create studies that help figure these things out here, but also participate in what other folks are doing to answer those questions.
Great, thank you. I'm getting a question through the chat about any risk of unvaccinated people being refused care at a hospital. I'll do my best to try and answer that. Susanna. Okay, sorry, I'm looking at the chat. There certainly are no plans to at all turn people away based on their vaccination status in terms of unvaccinated people being refused a ventilator or being refused care in hospitals. Obviously, as I've shared in multiple venues, many of you have seen me speak, we really want to make sure that everyone has the opportunity to be vaccinated. It is the thing that's going to get our community, get our state through this. But at this point, I from an ethics perspective, from a variety of perspectives, just a pure human perspective, I don't think we would ever get to the point where we're turning people away solely because they've chosen not to get vaccinated. The only point I think I would also add to that is we are seeing, and this is probably a little bit more than anecdotal, but I'm not sure it's statistically significant, some individuals who are unvaccinated who then get diagnosed with COVID, who meet criteria for the monoclonal infusion treatment, who are also turning down the monoclonal infusion treatments when they're offered. Their doctor says, you're high risk for being in the hospital, high risk for getting sick. You should get one of these treatments. And when our pharmacists and our physicians call them to try and consent them to have them come in to get the infusion, they turn that down too. So I do worry that there's a group of individuals that aren't getting vaccinated, that aren't masking, that probably aren't really watching what they're doing in terms of social distancing and so forth. And then when they do get sick, they're also turning down a therapy that can reduce your risk of being admitted by 70% if you're a high risk individual. So just the more education we can get through the media for people in terms of the benefits of these treatments and benefits of vaccination, the better off we're going to be. Any of our other colleagues from media have a question? Not seeing any other questions. I did put a link to the Healthy State Alliance guideline that was referenced earlier in Dr. Fredberg's comments. That was done jointly with colleagues from Bon Secours Mercy Health, and we're working together with them also on provider education. We had a large symposium earlier this spring, and we'll be doing another one later this year around COVID-19, really for basic updates for providers, nurse practitioners, social workers, everyone in the healthcare space on these issues. If there are no further questions, I think we will call it a day for this morning. Once again, I want to thank Dr. Fredberg for being here this morning with us, and Dr. Mohler, as always, it's terrific seeing you. And to all of our colleagues from the media, please thank you for all you're doing, and let us know if we can help in any way with any questions. Take care. Thank you all very much.
Recording stop.